I'm Dr. Sharda Jain. I'm going to tell you about what should be the gynecologist's approach for handling COVID-19 patients. Let's be very clear. There are three categories of people. People who are asymptomatic, people who do not have any fever, do not have any respiratory symptoms like dry cough or respiratory distress. People who have not come in contact with any person who is corona positive or suspected to be corona positive, anybody who has traveled in the last 24 days outside to any of those hotspots, or who has come in contact with people who have come back from there. Now if you're COVID negative, you are like any other emergencies which you see during this particular time. If you're COVID positive, but you are asymptomatic, or you have a very mild symptoms, in that particular case it is corona care clinics, it has to be managed with the home quarantine facilities where the care can be given at home, and the help is available phone call away. As and when things deteriorate, the patient can be shifted. Third is where the patient is corona positive and symptomatic, where you feel that the respiratory emergencies have cropping up. These patients have to be managed in corona care hospitals. So three things are very clear. Now, what should be the policy of the nursing homes? What should be the policy of the clinics? One thing is, we are not running a routine clinic. It's for emergency patients, new patients which also who have emergencies, no walking. Anybody who's walking to your clinic has prefixed the time, you have taken the history from them. This is called telephone triaging. From telephone you have made everything very clear. They do not come to any of the high risk category before they are walking in your clinic. Now, at the gate itself, the temperatures is checked, the hands are sanitized, the people either stay in the lower areas, they rest, only the patient goes up, sees the patient, patient is seen. Before patient is seen, she should hand wash it, again re-sanitize it. Everything has been checked up. The staff takes care that they have the mask. They frequently sanitize their hands. All the floors where you think is a possible chances is contact of a patient. Patient is also has a mask covering totally the nose and the mouth, and properly seen. The only thing is we have those paper sheets are available. One patient goes and then the sheets are changed, which we have been doing even before also. After every patient is seen that, we were washing our hands, but not only we are washing the hands, we are hand sanitizing also before we see another patient. So I think, that is routine. If a patient is going for any kind of surgery, say patient requires an emergency encerclage or elective encerclage, patient previous history. In that particular patient has to be tested for COVID-19. No case has to be done in those hospitals who are not COVID-19 hospitals. If they're COVID positive, they have to go. If people are dealing with emergencies and you think there is no time at all for a COVID-19 testing, in that case, they have to be managed as a COVID positive patient unless proved otherwise. So naturally, take an example of a delivery. The nursing staff, the paramedics, the ladies who are the people who clean up the floor and lawn have to take utmost care as we do in HIV cases. So that kind of a care is required. So nobody is infected. We have to take care of ourselves. We have to take care of our whole of our staff. So that is what is required. And in case if you have delivered a patient taking due care of everything and it turns out to be corona positive, it's unfortunate. In that case, you have to duly informed, get your all staff screened, and you have to be under their supervision. You have to be quarantined. Your clinic setup has to come to close for 14 days. So this is all what we have done. From time to time, we have to see to it that we sanitize and do things. If you take care, we will be protected.